Hi, good evening. Welcome to the Weston Park Staff Nurse Careers webinar on this very, very pleasant June evening. I hope everybody's well and thank you so much for taking the time to attend. So the purpose of this event this evening is for us to showcase some of the opportunities that are available for nurses in Weston Park Cancer Centre. So we have a range of speakers today who are going to sort of present some of their experiences and showcase those opportunities. So there are a number of colleagues lined up to speak to you. I think what's very special about Weston Park is that we don't just cover and care for patients from Sheffield. We will also work with a number of regional partners, and that will be sort of demonstrated through the speakers this evening. And there are also a lot of opportunities to sort of get involved in diverse roles, such as research, both for supporting research delivery of clinical trials, but also around nurses developing and leading their own research portfolios. So very, very sort of diverse opportunity, lots of kind of career pathways that are available to you. So I'm going to pass you over now to Senior Sister Amanda Traynor and Stuart Amos Matron, who are going to talk to you about why Weston Park is so special. So Amanda.
Thank you, Ali. My name's Amanda Traynor and I'm the Senior Sister on Ward 2 at Weston Park. I qualified in 1995 and after working in various settings, I decided after doing an oncology course that I would look at Weston Park. I've been a Senior Sister at Weston Park for 8 years. I started at Weston Park in 2001 as a ward sister, band 6. I had no oncology experience whatsoever. I'd never done oncology, and I transferred from a surgical ward, and I have managed a 30-bedded oncology ward for eight years now. There's many reasons why Weston Park is so special. There's lots. I could literally talk all night regarding why we are so special as a team and as a hospital. Mainly the patients. The patients of Weston Park are literally phenomenal. It's the main reason why I've stayed here for 21 years. Their courage and strength is exceptional, and supporting these patients throughout their treatments is truly a professional honour. Both the patients and staff combined are actually what makes Weston Park so special. You build up relationships with patients and families, which is both unique and rewarding, which adds all to the job satisfaction. Cancer nursing has so many different components to it, obviously dealing with their physical and psychological needs. The patients will need you at every part of their cancer journey, and it truly is a privilege to continue to work at Weston Park. I cannot think of anywhere else I would like to work. It's truly one of the best places I've ever worked, and I think one of those reasons is it is quite a small hospital, classed as unique, but we're an amazing team and we all work together really well. We have a very supportive environment. We have a wealth of experience, and we're here to share that with all of you today. Why don't you come and join us, and you won't regret it. Next slide, please. Next slide, please. Weston Park Hospital is based in Broomhill, Sheffield. We're one of only 4 dedicated UK NHS cancer centres, and we treat solid tumour cancers such as lung, breast, head and neck, and much more. We see patients from across the South Yorkshire region and as well as the wider UK for more specialist treatments. We are truly an amazing hospital. And over to Stuart. Thank you.
Hello everyone, my name's Stuart Amos. I'm the Outpatient Services Matron at Weston Park. I've worked in Weston Park for over 10 years now in oncology. Weston Park is a centre for outpatient, inpatient, non-surgical cancer care, including chemotherapy, and it's one of our leading radiotherapy centres in the country. All departments are really well led and staff are well supported. Our departments are the outpatient department, which sees over 200 patients in a day and sees patients at the start of the treatment, going through the treatment and follow up after. And we also have a nurse-led immunotherapy chair department on the 4th floor as well. The nurse-led day case unit is on the 1st floor. It's where patients come to have their anti-cancer therapy treatments. It's a Monday to Friday service currently, which runs from 8 AM till 8 o'clock. Patients can vary the amount of time that they're on the department for. On average, the day case can treat between 60 to 80 patients a day, so we have a significant amount of activity. And we work closely with the Cancer Trial Centre to provide valuable research into new drugs and treatments. The radiotherapy department is on the lower ground floor, but also we have a CT, MRI and X-ray facilities. The radiotherapy treatment treats approximately 300 patients per week. We also have 2 inpatient wards, Ward 2 and Ward 3. These are 30 bedded patient wards and recently been refurbished in the last 3 or 4 years, as you can see from the pictures on there. Patients come to the wards to have treatments, end-of-life care, investigations or procedures as part of that cancer journey, and each ward has its own specialities. So Ward 2 specialises in head and neck cancer and also has special lead-lined rooms to be able to receive specialist brachytherapy treatments for ladies with gynecological cancer. Ward 3 also has the teenage cancer unit, so it treats teenagers with cancer. I used to be the senior charge nurse of there before I came into this outpatient specialist matron role. We also have a GTD specialist area as part of that, which is for ladies with a very rare placental cancer, which Kam Singh will go into some more detail about her journey further on in the presentation. There's also an emergency admissions unit as part of Weston Park, where the patients can ring a triage line and a nurse for advice. The nurses then triage them and assess them. This is a medical and clinical nursing team, specialist nursing team, with advanced clinical practitioners and a nursing team whereby patients are supported throughout that whole journey. If patients do come to the assessment unit on the 3rd floor, they might have tests and investigations. They may be able to go home. If not, then we would admit them to one of the wards and make a plan of care from there. Next slide, please. Our patients are at the heart of our service. It's what we're all here to look after and to do the best that we can. Many of our patients have treatments in the day case, so the elective pathway, and also are admitted to the ward as well for elective chemotherapies. As touched on before, we've got outpatient departments, and the inpatients and patients can also be admitted as emergencies as we've gone through. We do have patients that are admitted for end of life, and although we work with patients and families to make sure that patients' last days are where they want to be, if that's possible. We really work closely with members of the multidisciplinary team to ensure that patients and relatives and patients ensure the highest standard of care and patient experience in our service. Next slide, please. As mentioned, Weston Park patients are across all of the South Yorkshire and Bassetlaw Cancer Alliance. We have 2 Weston Park at sites. We've got the Burley Medical Centre where the day case nursing team rotate to. This is a really, it's only been open since January last year. Patients and staff love working there. The feedback is really, really positive, and it allows patients to have chemotherapy closer to the home because it's a 7-chair treatment unit in a GP practice in Barnsley. And we've also got breathing space in Rotherham, which is an outpatient facility as well. We work really closely with our district general colleagues who deliver treatments on the day case units for Weston Park. And if anyone's interested, we can pass details on to our DGH partner units, should you be interested in applying there as well. Thank you so much for your time. I'm now going to slide out of screen, and Neve Garrad is going to give you some experience of coming here as a newly qualified nurse. Thank you so much.
So I'm Neve Garrad and I started working at Weston Park as a newly qualified nurse about 3 years ago. I decided to come here because I'd started here as a support worker just before my studies, probably 7 years ago, and I knew that I loved the patient care that we did back then. Did my training and still came back and did a few shifts here and decided it was definitely for me. Applied for the Weston Park rotation, which included Ward 2, Ward 3 and the day case unit. And it gave me valuable skills in all different areas, including learning chemotherapy on the day case unit, which at other places you wouldn't necessarily get the knowledge of. I went to Sheffield Hallam University, so I stayed close to home and still stuck around the same typical area with Weston Park. I have developed many skills, including things like cannulation, venipuncture, and more specialised skills, including the brachytherapy treatment that Stuart talked about earlier, which is a specific treatment given on Ward 2. I enjoyed doing the rotation because it was nice to just see different areas and go through the patient journey at different points. Again, you'll see different points from each point wherever you work from, and you'll get different knowledge from there. I think working at Weston Park is really nice because of the fact that everyone's a bit like a family. Everyone knows each other and it is a small hospital, like they said, and you just get to know everyone and it is a friendly place to work. The patients do make everything much easier to work here as well because they are taking everything in their stride and they are really incredible patients to work with. So I'll pass you over to Sweety.
Thank you. I feel very proud and privileged to embrace this opportunity to share my experience as an oncology staff nurse in Weston Park Hospital. I worked as a staff nurse in Ward 3. Basically, Ward 3 caters to the patients undergoing chemotherapy, that is systemic anti-cancer treatment. Patients coming with its toxicities, acute medical oncology patients. We also cater to the patients with radiotherapy, palliative care, end-of-life care. So the experience was immense. I'm an international nurse from India and I came to UK back in July 2021. When I look back to my initial journey in NHS, I vividly recollect the tough days of adaptation and settlement to a new country, to a new department, to new specialty. Nevertheless, I was privileged to receive immense support and guidance from the excellent education team here, my managers, my team leaders. It is widely known that the first and foremost challenge for any international nurse is to pass the OSCE exam. There was tremendous support by where we were provided with dedicated hours, articles, guidance, practice hours, which really helped me to pass my OSCE in my first attempt. Every day we were asked about our well-being. There were tremendous support, helping us to adjust to the new environment, thus ensuring a smooth transition from a pre-registered nurse to a registered nurse. So after completing my OSCE, I was a registered nurse in Ward 3, and the journey continued, and I was trained to handle the central venous access lines, the PICC lines, Hickman lines, done my SAC training. Eventually, I realized that cancer care is demanding, but it's highly rewarding. I was never into this oncology specialty before. I was a cardiac nurse and I also always wanted to go back. But the experience in Ward 3, taking care of the patients, especially the palliative care part, it really touched me. And I made the decision to continue my journey as an oncology staff nurse and have my career growth into this specialty. Cancer care is actually a journey. It's not like we are fixing a heart or a leg and we're asking them to go or the journey ends there. It's being there for the patient and their dear ones in their darkest time is really rewarding. Developing that special bond and relationship with patient, their near ones, is very rewarding. I say oncology as a super specialty because here we take care of cardiac conditions, respiratory, renal, bowel, palliative, because cancer can be anywhere and its toxicity can affect any system in the body. Here we learn about new drugs, new diagnostic measures, genetics, research, Every patient comes with a new learning and a new experience. We learn and we evolve every day. The training opportunities are tremendous and rewarding. The growth opportunities are really extensive. As an oncology staff nurse, you can grow as a SAC nurse, a specialist nurse, a nurse practitioner, nurse consultant, research nurse, palliative care nurse. It's immense. It's just you need to have that passion and dedication. So yeah. So eventually, I realized that cancer care is demanding and it's highly rewarding. Because cancer care is not just an experience, it's a journey where the patient and their dear ones, being there for the patient and their dear ones in their darkest time is highly rewarding. Developing that special bond and relationship with the patient and their dear ones, it's really rewarding. Here, we are not just fixing a leg or a heart and bidding them a goodbye, but it is being them with them in their journey. So it's highly satisfying. And I was a cardiac nurse. I always wanted to go back, but after coming here, having this experience, I really took this decision to grow in this specialty because it means a lot for the difference that I'm making in the patients and their dear ones' life. I say oncology as a super specialty because here we take care of cardiac conditions, respiratory conditions, renal, bowel, palliative management, because cancer can be anywhere in the body and its toxicities can affect any system in the body. Here we learn about new drugs, new diagnostic measures, genetics, research. Every patient, it's a new learning for us because cancer treatment is evolving and advancing every day. The the training opportunities are immense. The growth opportunities are extensive. You can be a staff nurse, an assessment nurse, a SAC nurse, a specialist nurse, nurse consultant, research nurse, acute oncology nurse, nurse educator, lead nurse, and the list goes on and on and on. Here we are a small team, and it makes this working in this environment very special. If anyone is determined and strongly willing to learn, having passion, compassion, and dedication to excel and to make a real difference in someone's life, this is the right choice for you. I feel oncology setting is the best opportunity that you can get. My experience, my faith in God, and my credentials have eventually enabled me to grow as a clinical nurse specialist. And I take this opportunity to thank everyone and best wishes for anyone who is willing to join this specialty. Next on to Kam Singh.
Good evening, everyone. So I'm going to talk about a place to grow your nursing career. So I am a nurse consultant in gestational trophoblastic disease, a disease incredibly rare. And Sheffield is fortunate in that we are the Northern Specialist Centre for this rare disease. And we will have women that travel from all of the north of England and North Wales for their treatment. So my role is to ensure the safe delivery of high quality care for women diagnosed with GTD, and also to provide expert clinical nursing advice, education and leadership within this speciality. And my journey began as on an elective placement in 1996. And as soon as I came to Weston Park, I loved the ethos of what Weston Park is. And I continued my my student nurse career, and I applied for experience, and I worked as a support worker in all the wards, and eventually managed to secure a job as a newly qualified in 1998 on Ward 3. And I threw myself into all of the educational programs that were available, ensuring that I was meeting all the competencies to be able to deliver the service to my group of patients, cannulations, cytotoxic drugs, looking after CVADs. I very quickly topped up my advanced diploma into a degree in 1999, and then from there in 2000 was given the opportunity to do the mentorship teaching and assessing course as well as the oncology course, and those courses enabled me to apply for a senior staff nurse post. Back in the day there was a differentiation between junior staff nurse and staff nurse, a senior staff nurse. And I was one of the core members of the teenage cancer unit when it first opened in 2002 as a senior staff nurse. And a year later, I decided to go on to permanent nights. So back in the day, we used to have separate permanent night staff. and I rotated on all the wards and continued to progress. And in 2005 was given the opportunity to apply for the night sisters post, which I was successfully appointed. And while I was on nights, I also decided to further my academic career by undertaking my master's in oncology and radiotherapy. And I was always ambitious and always wanted to go that extra mile, and knew that I didn't want to stay on nights long term, which is why I undertook the master's. And then from there in 2011, an opportunity came up to become Ward 3's ward manager, which I was successfully appointed. And I undertook that with various leadership qualifications, and took on the job as the ward manager. Very challenging, but thoroughly enjoyed it. And then in 2013, a fantastic opportunity for the lead clinical nurse specialist in GTD came up, which I have been doing for the last 10 years. And in January of this year, I was appointed the nurse consultant. So 25 years of nursing, and I have to say lots of hard work, dedication, and really putting myself out there has enabled me to become a nurse consultant. And I have done various publications and been a first author in many journals, and have been a co-author in many studies. And within my nurse consultant role, there'll be lots more opportunity to publish. And I have recently, amongst my European colleagues, published best practice nursing guidelines for GTD patients. And I have to say my biggest achievement to date has to be being nominated for a Compassion Award by one of my patients. And we don't go into nursing to win awards. You know, we go into nursing because we are passionate and we want to nurse. But to be nominated for an award, it's just, I guess, the icing on the cake. I didn't win the award, but I was given recognition for my services by the charity, which, you know, which means a lot. And so there's lots and lots of opportunities. If you work hard, show your dedication, put yourself out there and show willing, your skills will be recognised and you will be given opportunities to flourish. And it is a fantastic place to work. You know, I've always loved the ethos of Weston Park, and I echo everything that everybody else has said. It's a lovely small place to work. Everybody knows each other. We have really supportive managers, supportive senior staff. And, you know, if you really want to, you can grow. So come and work here at Weston Park. Thank you. Over to Cherie.
Hi, thank you, Kam. I'm Cherie. I'm the clinical educator at Weston Park Hospital. It's my role to train you to be the best oncology nurse you can be. So next slide, Edgar, please. For newly qualified nurses, your journey begins with a 6-month trust preceptorship course that involves study sessions, assessments and competency sign-off. Running alongside the preceptorship is the Weston Park 18-month rotation, which gives you an experience and opportunities to have 6 months on Ward 2, Ward 3 and either outpatients or day case. This enables you to get an overview of cancer, patient's journey, as well as learning all the clinical skills. These skills include venipuncture, cannulation, ECGs, IV medication, central venous access devices, and systemic anti-cancer therapy treatment. If you're a staff nurse new to oncology, you will get a detailed training plan aimed at the skills you need to gain and to become the oncology nurse that you want to be. Next slide, please. After completion of all your oncology skills, you can progress onto the development framework to help develop your newly qualified skills and start to plan your future. For newly qualified nurses, the aim would be for you to start the framework after 18 months. Once you have your skills, you will be able to apply for secondments, posts across Weston Park, and after 2 years experience, have the opportunity to apply for any Band 6 jobs within Weston Park. Your career at Weston Park can take you anywhere your heart desires, whether that be a research nurse in clinical trials, a clinical nurse specialist, or advanced clinical practitioner. The clinical educating team will help you, be here to help you and guide you on your way. Thanks for listening to me, and now I'd like to hand you over to Julie Neal, the inpatient matron.
Welcome. Thank you very much for coming on this evening. My name is Julie. I'm the inpatient matron. As we've already described throughout this, there are obviously very different areas. I also have an area within my patch which is to do with the emergency, and there are lots of exciting new roles happening within that. I'm basically I had no oncology experience, and 7 years ago I took the trip into Weston Park from neurosurgery, and guess what? I've stayed here. I love it. It's amazing. It's phenomenal, and I've got an amazing team, and we all work together, we develop together, we support each other. We're very open, and you can basically, you know, touch base with any type of manager here, as you can see by our nurse director being here. The doors are always open, so I think that is really, really important to us, and it is really important to all of us to keep that going. I'm just going to talk a little bit about the staff benefits. So obviously, as a part of Weston Park is a part of the Sheffield Teaching Hospital Trust Foundation, and that includes the Northern General, the Royal Hallamshire, which is just across the patch here, and the Jessop's Wing. We are actually have a bridge which is attached to the Hallamshire now, so it is great to be a part of the whole bigger, wider picture. While we have a distinct identity at Weston Park, it also means that we have access to all aspects and all staff benefits, supports, discounts throughout the trust. Those are new NHS, for those new in the NHS and new within us, you have access to good annual leave, pensions, different working arrangements where possible, and this can all be found within the STH website, and you would be given support there as well when you came to us. Access to lots of discounts, offers, local businesses, national chains and retailers, which I think is great. Staff are well supported, and obviously it's really important in today's world that staff well-being and employment assistance is there for you. There's a counselling service, there's on-site childcare, which obviously is a big tick. There's some discount within travel, car and lease cycle scheme is available, and there's some very nice electric bikes going, as I keep passing it recently. There's absolutely loads more, and you can see all of this within online and within a booklet that we can deliver. Next slide, please. So, how to apply for further support. As you can see there, at the moment we are recruiting for band 5 staff nurses, but there are other development opportunities which is coming online soon, and I will come to one of the questions actually which we'll look at that. So there's a big jobs website which we will share with you, as you can see on the slide at the moment, but that is also you can go on to the STH website, and it's quite easy to navigate through that and to see what jobs are available. We've got some adverts that are going out in the next couple of weeks, and as you can see there's some dates on there already, so please jump in, that would be great. And if you needed any support, then obviously you can come to any of us at Weston Park to help you with that. Again, it's on, we have a website as well at Weston Park, so please look at that. I think you'd get some quite good information from there. For anyone joining from us abroad, as you can see, we have Laura Fensom, and her email is on there, and also you can get some guidance from Cherie, will help to support that. So all that information is there, and if you want to put it in, if there's any questions you have, by the way, please start putting them on now, because we're more than happy to interact and support and help you now if you'd like to do that. Don't feel afraid, just shout out and give anything to us. So there's lots of support out there, and there's lots of help, and we are a very willing team for you to come to meet us and to come and join us. Now, I do have a couple of already questions which I'm going to share, and I'm also then going to actually pinpoint to certain people on this panel, if that's okay. So one question that has come to us is, what advice can you give newly qualified nurses starting out, and what will help them starting their oncology career? And Kam, I would like to maybe put that question to you, if that's okay.
Of course. So I think it's about really working hard and showing your skill set, and putting yourself into, you know, getting out of your comfort zone, and, you know, really being vocal about wanting to, you know, to take up all the skills that are available, you know, not being shy and sort of staying back, but actually coming forward and saying, well, actually, I think I might have a go at taking charge of the ward, and really pushing yourself. Because if you're proactive, you know, your seniors will notice that, and that's how you will be able to progress and have more responsibility and take on, you know, further roles, and that will enable you to continue to progress. So don't be shy and put yourself out there and work hard. And I can't say that more than enough, really. It's about having that work ethic, and, you know, going that extra mile, because that will be noticed.
Thank you, Kam. Thank you, Kam. I've got another question, and maybe Ali can just step in here if there's anything that she has any new. It's, have we got any roles specifically for nursing associates?
Thank you, Julie. Thank you, Julie. So we have had nursing associate roles within Weston Park Cancer Services. We don't have a huge number of nursing associates within cancer services, because generally we have always managed to recruit registered nurses. However, if you are a nursing associate and you've qualified, you've completed your training program, what I would suggest is that you get in touch with, you know, via the routes that we've kind of highlighted today, and kind of let's have that conversation. We aren't supporting trainee nursing associates at the moment within cancer services, but we've certainly got opportunities that would be open to individuals should they be interested. So please do get in touch. Let's have that conversation and think about how we could support nursing associates in their career development, etc. Thank you.
Thank you, Ali. Thank you, Ali. I have a next question is, and if the person's out there, they're all more than welcome to get in touch so we can support them. You have actually put here, is paramedics from international, can they apply for this opportunity? They can't apply for this opportunity, I'm afraid, but what we can do is we could obviously point you in the right direction, and we could support you in any way. So if you'd like to get in touch with us, we can see what we can do about supporting you with going to, if you are still very interested in that. I have another question. I am an overseas trained nurse. How can I apply for pre-registration nurse job and get support for OSCE? And the person for there is Cherie, please.
Hi. So unfortunately, you can't apply directly to the trust if you're an overseas person. You do have to go through the overseas team. So the best idea would be to contact Laura Fensom for her to be able to direct you to their application form. You can't apply via this route because we need staff that are already NMC PIN registered. You have to go for a special route to be able to come in as an international nurse who hasn't done their OSCEs yet. Thank you very much, Julie.
Great, thank you. Well, one more question. Are there any roles suitable for nurse prescribers, and are there opportunities for flexible working to fit with childcare? I'd like to put that to Stuart, please.
Well, thank you. Yes, there is opportunities for nurse prescribers. We're all about advancing nursing and looking at that workforce. So the majority of the services within Weston Park have got advanced clinical nurses, and that nurse medical prescribing is something that we really want to advance our service with. So that is correct. You need to contact one of us on the call or follow the directions. In relation to family working, it would be we really would meet with the trust requirements for that and work with you alongside being able to meet flexible working or childcare arrangements, bearing in mind the service that we need to cover by that support. We do have staff in my service who are restricted within that, but we need to have that conversation about that flexibility, but we'll make sure we do everything that we can to support that given the circumstances. But obviously we need to ensure we've got the service to run for the patients. Thank you, Julie.
This is lovely to get lots of questions. Thank you, Stuart. So I've got another one. Are there many specialist nurses in Weston Park? I'm not quite where to start here because we have quite a lot. So I'm going to do a little bit, and I wonder if Ali, you might like to step in as well after me. So obviously we have a lot of specialist nurses, and when I arrived here, we started building that team within different tumour sites. And as I said, it was like putting a map out of the body and trying to attach a nurse to each organ. But I think it's very exciting because it's slowly developing. We also have a great ACP team that we are developing. Ali, would you like to, is there anything else you'd like to add to that?
Thank you, Julie. So yes, so I think career pathways, obviously you've seen Sweety, who's described her fairly recent development into clinical nurse specialist. So we have got a number across quite a wide variety of services. So yes, absolutely, Julie, tumour site teams, but we've also got teenage specialist nurses that support teenage young adults within our services. That's just off the top of my head. There are innumerable CNS opportunities that we have available to us, and actually through that progression of developing advanced practice skills. So we've touched on the non-medical prescribing qualification, but also APACs, and we have had CNSs. Kam is just one of 4 nurse consultants that work in Weston Park Cancer Services who have gone on to develop their careers and kind of advance that CNS role into more senior CNS roles and then onto nurse consultant, or have gone via the ACP route, so the advanced clinical practitioner route, of which we've got a number of functions also. So I think if you are keen to advance your skills and develop new opportunities, then we are certainly in a position to be able to support you through that. So thank you very much. Thank you, Julie.
Thank you for that. Thank you for that. That's, as I say, it's great opportunities. Sorry, we've got some more questions coming in. How do we support newly qualified nurses from university? Cherie.
Hey, so for newly qualified nurses, we've got an induction program that's for the trust. So the trust have set you up in cohorts to get you all together. From Weston Park point of view, we do pre-meetings before you come in as a newly qualified. We then have regular training sessions. The training plan is set for you as soon as you arrive, with constant support from the clinical education team. Plus you'll have a mentor / supervisor on the ward. Plus you have your ward managers and your sisters all supporting you to gain the skills that you need. If for any reason that you feel that you're not achieving or you're struggling a little bit, we have put in support mechanisms, whether that's be one of the clinical educator team come and work with you every week for a couple of weeks so that you can get your confidence and gain your skills, but also help buddy you up with somebody else. We do try and buddy up the newly qualifieds together. So the next lot that are coming in September, we're having a coffee morning before they start, so we can all introduce ourselves and they can get familiarisation with the unit before you come in on your first day. and we try and sort everything out so it flows nicely. So get your uniform organised, get all your name badges ready so that when you come, you're ready and there's no mishaps, hopefully. Thank you, Julie.
Thank you for that, and lovely. Keep that lovely. Thank you very much. Lovely. Keep these questions coming in. We've just had another question about somebody that has is newly qualified, but has actually gained a place elsewhere. But I think hopefully following us, she'd love to come and work for us. How does she do that, Cherie?
So if you've applied via HR, the central recruitment for newly qualified nurses, contact HR and just tell them that you've changed your mind. Then HR will contact either Julie or Stuart to say, make sure there is a vacancy for you. And then as long as they agree, which I'm sure they will, they then contact me and we then help sort it out with HR and get you transferred over onto our system, ready to start later on in the year. Thank you, Julie.
Amazing. Keep that going, please. Come on, is there any more questions? It's like being a bingo, isn't it? This has been absolutely fabulous. I'm sure the rest of everybody would absolutely say this has been great, and you know, thank you so much for being there and listening. I don't think if we haven't got any more questions, then I'll be handing you back to Ali. But thank you for joining.
Thank you, Julie. Thank you for handling the Q&A section so professionally and seamlessly. You could be a bingo caller, I think. Thank you so much for attending this evening. I hope you feel it's been a useful and informative session. I hope you feel that we've managed to showcase some of the really sort of exciting opportunities that are available at Weston Park Cancer Services. We do really want to, you know, employ staff that want to work with us and deliver the absolute best patient care to our patients who touch our services, and you know, the impact that then we have on the patients and their families. And that's absolutely a critical part of everything that we do and runs through our everyday ethos, I think. So I hope that has sort of made itself obvious to you this evening. That's it for this evening. So I really would like to thank you so much for attending. We are going to ensure that this session's available. So if you think other people that you may know or kind of work with would be interested in a career within Weston Park Cancer Centre, please do let them know. Pass on the webinar details, and any questions you can always come back to us. I think we've got points of contact going out as part of this event. So thank you so much. I hope you manage to enjoy the rest of the evening and the sunshine that's still out there, because I can see it through my window. So please do have a lovely evening, and thank you once again.